Teaching collaboration has been proven to be really central and important to patient safety and to good patient outcomes because physicians are an important part of the team, but they really function within a team and a system. Interprofessionalism and intra-professionalism are both really very important. Interprofessional is about the ability of different people working in the health system to work with each other to achieve shared outcomes. So, if it's an inpatient emergency environment, there's nurses, there's doctors, there's pharmacists, but there's also non-health professionals in the team. There's the floor cleaners and the ward orderlies, because really it takes both the professionals and the support staff to affect good outcomes. On a practical basis, it's knowing each other's names. It's knowing each other's roles. And while it sounds pretty simple, in each of the training centers that our residents work in, the team environments and the compositions are different. In one place, the nurses might be doing one type of activity. In another place, the physical therapist, the occupational therapist might be doing those same activities. So you really need to know the names of the people that you're working with, because you come and go from different wards and floors, and the people around you have different roles and responsibilities depending on the work environment. So you need to know who the people are and what they do. And then as it relates to a given patient, what are those patients' needs and aspirations, and how can each of us do our own piece of the puzzle effectively and efficiently to deliver good patient care. We see collaboration in team meetings, we see collaboration in team rounds, we see collaboration in handover where one team maybe took care of a patient overnight and then the next morning another team is taking over. So there are sort of episodes where we see a particular focus on teamwork. And to that extent, we've identified, some of the good features or best features of what a good team meeting looks like and what a good team handover looks like. And so the toolkit really provides sort of some organizing framework and some specific criteria about what to be looking for. From a tool perspective around teamwork and collaboration, it's important to ask the different members of the team, what's this person functioning like as a team member? Because the best of our collaborators are collaborative with all members of the team. But some of our residents are not as equitable in their collaboration skills. And so what we're really trying to do is make sure that somewhere in people's residency education, we get feedback from the nurses, the pharmacists, the therapists that residents work with, to really get some feedback about the approachability, the communication style, the shared decision-making approaches that our residents have, because it's really a reflection of my teamwork skills if my teammates actually tell me how well I'm sharing and communicating with them. I think there's a growing appreciation for the need for what we would describe as 360 evaluation or multi-source feedback, where we get the input from a variety of team members about collaboration. I think that with the Collaborator Toolkit, there are some very practical solutions about either how to implement those without an extraordinary amount of effort, because the tools are ready to use and or modify, or to really look at the tools that you have in place and see if they reflect the literature on best practices on their design and implementation. So the toolkit really offers the newbie to start it, or if you've got something, an opportunity to reflect and evaluate your approach. We wanted to provide ready-for-use tools, but we also understand that context is everything. And so what's useful to one residency program or one location in Canada or the world is different than what we could conceptualize. And we wanted the tool to be practical. We couldn't have 1,000 tools, so we provide samples and examples ready in open format, for example, Word or PowerPoint, so you can use one slide, one tool, one learning activity, and modify them for your own use.